about the immune system now and the importance of strengthening it when it comes to sickle cell disease. And thankfully, people are beginning to pay attention because you've got to start there, especially if you have a child in Nigeria, one of these sub-Saharan countries where there's a lot of tropical disease. The immune system is under a severe amount of stress and burden to function, and many times it just can't keep up, and so you need to strengthen the immune system. And of course, we get in arguments with hematologists and people who deal in this field, and they're like, well, how do you know the immune system is compromised without you testing for it? And I'm like, well, the literature says so. Maybe you haven't checked yet, but it is very clear. And there are hematological reasons. There's things about the macrophages, there are things about the neutrophils, there are things about the spleen that makes them more susceptible, or they'll make them weaker, let's use that term, in people with sickle cell disease as compared with their peers. But we don't have to go that far. If you think about it, if you really think about it, the name sickle cell anemia says something. It says that these folks do not have enough red blood cells in their bodies. And what does that mean? If you don't have enough red blood cells in your bodies, it means that your cells, the cells, tissues, and organs of your body are not getting enough oxygen, they're not getting enough nutrients, and they're not getting rid of the waste products. People with sickle cell anemia or sickle cell disorder, or at least the ones that I see, my kids, are below 25%. Now compare that with the average, which should be 35 to 40. And you can see that there's already a significant problem because these kids are not getting enough oxygenation. The immune system is not just made up of white blood cells, it's made up of other tissues and other organs which need this oxygen as well. So if your red blood cells are diminished, if you're having lower levels of red blood cells, it means that those tissues and organs are not getting what they need to function. So that's one. But the second obvious fact is that people with sickle cell diseases, especially the more severe ones, tend to have poor appetites. They don't eat well enough, and besides, even the little that they eat is being burnt up right away because their bodies are struggling so much to make up for the damage and trying to repair the damage and catch up, that they are already severely malnourished in the first place. And there's go to Dr. Google, right? Go to Dr. Google. The first page you get to when you type in the search query, nutritional deficiencies in people with sickle cell disease, and it's going to show you all the different deficiencies that they have. If you're deficient nutritionally, you can be rest assured that your immune system is also compromised. So it just makes sense. It makes absolute sense to start by strengthening your child's immune system. That is your number one defense against pretty much anything. So please pay attention to that. Thank you.